HealthWorks, providing trusted, culturally appropriate information and resources. We aim to strengthen vaccine confidence and prevent outbreaks of vaccine-preventable diseases where we live, worship, work, and play. Increasing access to vaccine and booster shots for diverse, medically underserved populations. Engaging communities, families, and businesses in the fight against COVID-19.
Welcome to HealthWorks, a podcast series that highlights the multi-state COVID-19 consortium in Georgia and Tennessee. It's led by Morehouse School of Medicine, Meharry Medical College, and ASHLIN Management Group in collaboration with academic partners, state and local health departments, community and faith-based organizations, and local businesses and business associations. This podcast series will discuss efforts of the consortium to reduce COVID-19 health disparities and advance health equity by strengthening vaccine confidence, by providing trusted and culturally and linguistically appropriate information and education, and to enhance access to COVID-19 vaccine and booster uptake to a diverse, medically underserved population in Georgia and Tennessee. This is a production of One Joshua Group and the HealthWorks Consortium, and thank you for joining us. Hello, I'm Kermit Payne, president of One Joshua Group and host for this 9-episode series. This unique consortium, HealthWorks, is funded by a nearly $9.7 million grant from the United States Department of Health and Human Services, HHS, and the Health Resources and Services Administration, HRSA, as part of its community-based workforce for COVID-19 vaccine program. Dr. Orletha Lozana of Morehouse School of Medicine leads the project as principal investigator, and Drs. Paul Juarez and Patricia Matthews Juarez of Meharry Medical College and Ebony Haynes of ASHLIN Management Group will serve as principal investigators at their respective institutions. This initiative includes as partners One Joshua Group, Black Girl Health Foundation, and Mojo Marketing. HealthWork aims to reach individuals in the most vulnerable and medically underserved communities. And these communities often have higher levels of COVID-19 infection and lower than average vaccination rates. This incentive will engage public health professionals, including HealthWork outreach workers, patient navigators, and health educators to conduct education sessions, COVID-19 testing, and vaccination events, and other outreach efforts. Dr. Lozana, Juarez, and Haynes, thank you for joining us. So, Dr. Lozana, why is this consortium partnership necessary?
Yes, this partnership is very important because it unites the broad expertise of Morehouse School of Medicine, Meharry Medical College, and ASHLIN Management Group. All three partners work with underserved communities, minority communities, and that's where their expertise lies. So this consortium is vitally important because this is the best partnership to address underserved communities that may be experiencing some vaccine hesitancy. Dr. Haynes, can you tell us why you believe this consortium partnership is important?
Absolutely. Thank you, Dr. Lozana. Few public health initiatives involve small businesses. Last year, ASHLIN Management Group held a webinar with representatives from the CDC and the CDC Foundation, NIH, FDA, and the University of Pennsylvania to discuss the engagement of small businesses in vaccination and communication efforts around COVID-19 in minority communities. So the HealthWorks program for us is really an extension of the work that we started last year. And in addition to educating small businesses and helping them take an active role in promoting the health of their communities, this program also provides us an opportunity to use technologies and data analytics tools in a public health environment and in public health efforts. And we feel that doing this will help us learn valuable lessons about the best ways in which we can engage businesses, small businesses, and minority owned businesses in this work here during the HealthWorks program as well as in the future.
Thank you very much. We wanted to ask you, Dr. Juarez, in the aims for HealthWorks, there was a mention of cultural competency as a strategy. Can you share with us the importance of that and its relationship to education and vaccination programs and the Health Work Initiative?
So I can start, Mr. Payne. One of the things we've learned in the COVID pandemic is that trust is really a key component in terms of people believing and following up in terms of getting vaccinated and the understanding the importance of getting vaccinated. And so cultural competency really is critical to that, and the ability of people to trust and understand the message that they're receiving, the ability to relate to the messenger. So it's not just the message that is important, it's the messenger and that trust that is established between the two. So we find that, again, cultural competency is that ability to relate to be seen as a trusted voice from the community. Thank you.
Dr. Haynes, ASHLIN Management's engagement includes the relationship of small business and education about vaccinations. Would you please tell us about the importance of including specific targeting of businesses in this much needed intervention?
Absolutely. So many people may not realize this, but half of the nation's workforce is employed by small businesses. So small businesses really should be considered a very important part of our frontline public health response. And we can tell by the response that we've received so far from small businesses that they want to be engaged in this work. Our small businesses and our minority owned businesses really do feel a sense of responsibility for the communities in which they do their business and the communities where their employees come from. So they want to do all they can. And it's not necessarily from a selfish, place either. These businesses are not just about making sure that the community is healthy so that their employees can come to work, but these businesses really do care about the overall health and well-being of their communities. And so we see small businesses and minority owned businesses engaging in this work as an opportunity for us to have a greater reach and a greater impact in terms of getting individuals and communities vaccinated, getting proper information, accurate information out to those communities, debunking myths that might be existing within those communities. And it's going to take the efforts of all of us engaged in this work, not just the public health professionals, but all of us engaged in this work in order to really make a difference in reducing those COVID-19 numbers in our communities.
Thank you. Dr. Juarez, the Tennessee program includes large businesses, especially warehouse and similar type of businesses. How are these business types impacted by COVID?
Since the beginning of the COVID pandemic, we have seen that large businesses, like warehouses in particular, are super spreader sites. They're, and for many reasons. One are the conditions of the workplace where people often are close to each other. They don't have the opportunity to social distance or to wear a mask. And so again, often, and then when you have large numbers of people getting COVID, it certainly has an impact in terms of employment and people missing work and again the opportunity for to have large numbers of people who are infected and unable to come to work, for people who are exposed and need to quarantine. It can have a major impact on the business. So in this, with the HealthWorks program, we will be actually going out to some of these large businesses and providing vaccines and education about vaccines and boosters on site. Thank you.
So, Dr. Juarez and Dr. Haynes, particularly, you mentioned the makeup of small business, of those individuals about which Dr. Lozana and Dr. Juarez spoke. These are the same people that go to work in these small and minority business, in these intergenerational homes. And access is an issue for many of these people because of issues related to equity and to disparities. I'm wondering, for both you, Dr. Juarez, and you, Dr. Haynes, how important is it to be able to provide this kind of information where people live and work and play and worship before they go to work every day? How is HealthWorks helping to provide some of that education and resources? We talk about the vaccinations, but they really are resources just as education are. What other kind of activities are you, Dr. Lozana, and you, Dr. Juarez, and you, Dr. Haynes, doing on the ground, if you would, so that these large businesses and small businesses don't become super spreaders?
So, great question. I think one of the things that we must highlight is that, it's important for individuals to receive a communication several times before it, really takes hold and people begin to act on that. So we, use those communications theories and those behavior change theories in this work in order to make a difference in the lives of individuals. And so when it comes to, engaging our businesses in this work, we are making sure that individuals have that additional touch point. We have small business health ambassadors that will be trained in each one of these participating businesses. And those small business health ambassadors will do a phenomenal job in terms of providing education to their companies, to the employees in their companies, to doing work in terms of assessing their where their company is in terms of making sure that that business is prepared to address COVID-19 challenges and truthfully any other type of pandemic that might come down the pipeline. But also, we want to make sure that those small business health ambassadors are also able to connect with trained health outreach workers so that they can work collaboratively to host vaccination events within the business or within the local community. But also those outreach workers can assist those ambassadors with making sure that they have the resources, the educational resources and other resources that they might need in order for them to do the best work that they can in getting the word out to their employee population. So we see that, that training of those ambassadors and that engagement with specific public health professionals from the local community are really key efforts in terms of, getting employees vaccinated, getting their family members vaccinated, getting those community members vaccinated as well. And again, it's going to take all of us, including those small businesses and large businesses, engaged in order for us to make a difference on the ground in the communities that we're serving.
And whereas Dr. Haynes and to a degree Dr. Juarez spoke about business, I wanted to step back for a moment to you, Dr. Lozana, and you, Dr. Juarez. You are providing resources and services and information, again, to where people live and where they work and play and worship, which will allow us to at least diminish, I think, some of the opportunity for businesses to become super spreader sites. So what kind of activities are you doing in Morehouse School of Medicine, Dr. Lozana, and you, Dr. Juarez, at Meharry Medical College, so that we can prevent people from becoming infected in their home or in their community and then going transmitting this in places where they work?
Right. Thank you, Mr. Payne, for that question. So most people think that the pandemic is over, but what we know that we're not out of the woods yet. So vaccination and masks remain our best defense against COVID and any of the variants. And so what we're doing, we're really targeting back to school events, preparing the young people to go back to school at the end of the summer. We're also targeting many of the we also are targeting a lot of summer festivals. So we know Georgia and in Tennessee, the summertime is the best time for everyone to get out and to enjoy each other. But these are also super spreader events, and so we will have events around the multiple festivals and music events and large, outdoor gatherings.
Mhm. And Dr. Juarez, the activities that you guys are doing at Morehouse, at Meharry Medical College?
We do a range of activities that start with planning in collaboration with our community partners and community vaccine providers. So every week we bring together partners from across the state to identify upcoming events and see if we can engage some of our community vaccine providers at those sites. As Dr. Lozana said, many of again, there's health fairs, there are many community events that are going on. We are getting geared up for Juneteenth, which will be occurring in June, to make sure that we have people there who can provide information about specific questions that people may have. Whether it could maybe pregnant women and vaccines, maybe questions about children and vaccines, and when the vaccines for children under 5 are going to be available. So we'll have people there to answer questions, to help address any of the concerns that individuals may have, so that again we can, and then we'll have community vaccine providers on site. And so we work to really bring the partners together so that they can, the community partners often have those trusted relationships with those persons that they serve. So again, working in conjunction with them addresses issues around trust. And again, we do a lot of collaboration. We are gearing up. We expect the vaccine for children under 5 to be approved probably in June and available in July. So that's right in the middle of the summer. So we are gearing up to work with our some of the parks and recreation programs across the state so that we can bring again our partners to address the education and or vaccine and booster uptake and provide those at these events. So we see that working with our community partners is really key to addressing issues, particularly in some of our minority communities and non-English speaking communities.
Mhm. So I'm curious, and this is just a step back to this question a little bit. So at one time or another in this conversation, each of the three of you have mentioned myths, misconception, misinformation, and trust. Do you have any tricks of the trade to help us address any of those straight off that you've been employing to reduce some of this and reduce vaccine hesitancy and improve the willingness, at least the interest in getting vaccinated and right now getting boosted? You have any tricks you want to share with us? Any secrets you've discovered? You're smiling, Dr. Haynes. You had any recent discoveries?
I wouldn't say that they are recent discoveries, but one of the things that is so important when we think about cultural competency is that you want to make sure that you are gaining the trust of the community that you're serving by using individuals within those communities who are trusted partners, trusted organizations, trusted individuals, to help take that message to the community networks that they have, to those communities that they may represent. And so for us on the business side of things, what we see is that the use of the ambassadors, individual employees who work within those companies, who get specific training so that they can go out and educate and debunk those myths as a best practice. Because those individuals are trusted individuals within those businesses. And so for us on the business side, our ambassadors serve as that trusted individual. And I'm anticipating that, in Georgia and in Tennessee, the one of the best practices for them would be the same thing, partnering with those trusted groups in those communities to help us engage individuals, particularly individuals within the minority communities that we serve, so that we can carry that message forward.
And Dr. Lozada in Georgia?
Yes, so I would say the secret is not really a secret anymore. So Morehouse School of Medicine has trained community health workers and outreach workers for over 20 years at this point. And we know that community health workers, outreach workers are really our best link to the community and our best way to dispel some of these myths. Because as Dr. Haynes said, these are trusted members of the community who relay vital information and so to the community members, as well as bring back information from community members, what are some of the myths that they're encountering and why they may not want to get vaccinated. And then once we hear that information, able we're also able to develop messaging for those particular communities. So I would say our secret is not a secret, and the outreach workers are vitally important to this effort.
We'd have to go back to James Brown, who is a Georgia native who says his papa's got a brand new bag. So we're taking advantage of the old bag and making it new and helping to increase some of that trustworthiness. Dr. Juarez, you mentioned the importance of the message and the messenger. How do you determine, and Dr. Lozada mentioned this, how do you determine who those valid people are to carry the message and be a part of the messengers for this initiatives and the other ones that you are doing in Tennessee?
So again, we have a community engagement core that's has been led by Reverend Neely Williams. She is a long-term member, resident of the community. She works with a lot of local churches, community groups. She's well known and respected. Again, and she leads that. She provides that, tells us what's going on and helps us communicate with people. When part of our strategy is try to have both community partners and health professionals available to answer questions. So if you get somebody that has again a more technical question, we make sure we have correct information. We always try to provide the source of the information so that people know that it's not just something that we're saying. Again, I think the whole issue of trust is really what's key here. So to have people that look and talk like people from from different communities is really key to this process. Again, engaging people from the community, recruiting people from the community, and then training them, whether just part of our team or as a community health worker, so they can also sort of work as extenders of of what it is that we're trying to do. But engaging people from the community, branding the information. We always very key to identify our activities as part of Meharry Medical College. Meharry is well known and recognized and trusted in the community. So we always, all of our team identifies not only with the program, but at Meharry Medical College. So those are things that we do to try to increase and sustain trust.
Now, I've heard about training and this certification. Sign me up. Where do I go? Tell me about the training. I didn't know that I could be certified to do this. So for either one of you, tell us about the training and tell us about the certification. We'll talk about how to sign up a little later, but if you can just tell us something about that here, either one of you.
I can start. We have really a formal community health worker certification program that we will be working with. This is one that, through our partnerships with colleagues at the University of Tennessee Health Science Center in Memphis, they developed initially for diabetes and other chronic diseases. The training consists of communication skills, motivational interviewing, patient navigation, sort of some general skills, and also specific to, again, in this case, to COVID-19 and to some of the groups that we will be reaching out to. One of those includes barbers. So they need to, again, we will be recruiting from different parts of the community that have access and different ways of reaching other parts of the community. And so I'm again, this is the community health worker certification. There's not a national standard right now for community health workers, but this program has been in existence for I think about 3 to 5 years. So they have a well sort of defined and program is both online and virtual and in person. So we're going to be starting that probably in the next couple of weeks.
Dr. Lozana, Dr. Haynes?
Huge boost to the support of the community engaged workforce. The award represents a much needed show of support for this under recognized workforce. These community outreach workers are uniquely positioned to provide frontline support to our communities. So, as such, in Georgia, we'll be training outreach workers, 100 outreach workers. We'll recruit these outreach workers through our community partnerships. We do have our Georgia CEAL team that will help us network throughout Georgia, and we will be recruiting and training community health. We will be recruiting and training outreach workers across the state of Georgia using ASHLIN Management's digital learning platform.
Thanks, Dr. Lozana. So, a little bit about ASHLIN Management Group's contribution to this. As Dr. Lozana mentioned, the community outreach workers will have an opportunity to receive their training through online training tools or an online training platform, which we call the digital learning platform. And that is really just a way for individuals to access training online. And, you know, in addition to the outreach workers being trained through this digital learning platform, our small business health ambassadors will also receive their training through this platform. And the great thing about the training that we're offering is that, we recognize for our businesses and our small business health ambassadors that, you know, individuals who work in these companies are busy during the day, and we want to be mindful of the flow of their work. And so our training is developed such that they will be able to stop and start as they need to in order to make sure that they're able to complete the modules, have an opportunity to practice any skills that need to be practiced, to engage in the activities for as long as they need to in order to accomplish the goals. But also, we use, and just like for the outreach worker training, adult learning principles. So these training components are modular. So, individuals can, take a little bit of training here, they can stop, pick it up a little bit later, do some more training, answer questions, engage in activities, and move forward until they complete the program. And for the businesses, they can complete these modules even with stopping and starting, within a day if they wanted to do it all in one day. But definitely within a 2-week period, we expect that all of our businesses will be able to go through their training and be ready to move on to the next step, which is really engaging with those outreach workers to get those vaccination events scheduled, to implement their action plan within their companies, and to do more engagement within their businesses, among their employees, but also in the communities that they serve.
Dr. Lozana, thank you very much, Dr. Haynes, for that. Dr. Lozana, so we aren't doing this in perpetuity. So this initiative has some duration, and just so we can get in mind when training may be available, how long this opportunity is going to exist, can you tell us the duration of this program, the HealthWorks program?
So the HealthWorks program is a 9-month program, and it will end October 31st, 2022. So I would say the bulk of the activities will occur between May and September. And so for the outreach workers, we actually have started recruiting outreach workers. So they'll be trained in cohorts. So we'll be starting with the first cohort in early May.
Great. And Dr. Haynes, we're going to ask this as a bigger question for you, Dr. Juarez, and you, Dr. Lozana, and you, Dr. Haynes. Do you have any upcoming events that we may want to mark on our calendar and follow up with those in the future podcast series? We'll start with you, Dr. Haynes.
Sure, thanks for the question. Absolutely. So we are currently in the process of recruiting minority small businesses to engage in this work. So if any minority owned small businesses are interested in partnering with us, if you have an individual that you can assign from your company to serve as an ambassador, we welcome you to participate. And so we have our next cohort of small business health ambassadors starting their training June 6th. So you have plenty of time to identify a person, get connected with our small business liaison, get registered and get your login credentials. And the other great thing about this is that incentives are available. So, keep that in mind as well. And so we have our first cohort will start next week. So it's a little bit late to sign up for that. However, we do have some other cohorts beginning June 6th, another one beginning July 11th, and there'll be additional dates communicated in the future.
So that is really exciting, Dr. Lozana. I think that you've got some more exciting things to talk about in the month of June. We know that Dr. Juarez is doing Juneteenth, and you've started something, your first cohort and your second. Any other dates we need to make mention of?
Yes, so another big event, which we'll be doing a vaccination event at the Atlanta Jazz Fest. So that's a huge event in Atlanta, Memorial Day weekend. So our HEAL clinic, Health Equity for All Lives, is a student-run clinic that's a part of this HealthWorks program. They'll be out there doing vaccination. So I would say that's our first huge event, and that is the end of May.
So this is really exciting. We have an opportunity to learn, to help our family and to help our neighbors to increase the uptake of vaccination, including boosters, and to provide information for our audiences where they live, work, play, and worship, and also where there are larger super spreader opportunities. In closing, since Dr. Lozana is the principal investigator, we want to toss the last word to her and also to thank Dr. Haynes of the ASHLIN Management Group and Dr. Juarez with Meharry Medical College for their participation. Don't think this is the last time you'll be seeing them, so they will be on some of the future episodes. Dr. Lozana?
Right. So we are very excited about this grant and this opportunity and very thankful to be able to bring together our community partners in Georgia and Tennessee to augment the mitigation efforts already in place to address COVID-19 in minority communities. So we are thankful that we have this opportunity and we will decrease COVID in Georgia and Tennessee.
So thank you. This HealthWorks podcast series is supported by the United States Department of Health and Human Services, HHS, and the Health Resources and Services Administration, HRSA, as part of its community-based COVID-19 vaccine program. The contents of those of the authors and not necessarily represent the official views of, nor any endorsement by HHS, HRSA, or the U.S. government. Be sure and subscribe to our upcoming podcasts and be alerted for those future episodes and share this information with your family, friends, and colleagues. And here's to bringing about a great change and improving health. Remember to stay safe, be kind, and be compassionate. And here's to your HealthWorks. Until next time.
HealthWorks, providing trusted, culturally appropriate information and resources. We aim to strengthen vaccine confidence and prevent outbreaks of vaccine-preventable diseases where we live, worship, work, and play. increasing access to vaccine and booster shots for diverse, medically underserved populations, engaging communities, families, and businesses in the fight against COVID-19.